So tonight we're going to talk about glands, and anemia and more glands. This medicine that we're going to talk about, I'm taking it right out of my Materia Medica, and if you can see all my notes. I'm constantly writing, and then that's the way I laid this Materia Medica out, folks, is I left a lot of open space so that you could keep your notes in it. This is what it looks like. Should you be ever interested in, let me get it in the camera properly. You can go to my website and you can purchase it should you be so inclined. But tonight I'm going to talk about homeopathic medicine that is a cell salt, C-E-L-L, salt, S-A-L-T, 2 words. Sometimes these cell salts are called tissue salts. Sometimes they're called Schussler's salts because it was Dr. Schussler who discovered their use in human health. And there are 12, and to be honest, there are many more nutrients and aspects of the human blood and bones and cells, etc. But back in Dr. Schussler's time, he came up with 12 basic ones. Now, I teach Schussler's cell salts in my Gateway to Homeopathy courses in the study groups. And so should you be interested, and I urge you, if you're not part of a study group, do consider it. Go to my website and consider joining. It's super inexpensive, and you get to meet like-minded people from all over the world. More often it's from North America, but nonetheless, it's from folks from all over the world, mostly mothers and grandmothers, but we do get the occasional dad or grandpa. And you'll learn more about these tissue salts, homeopathic tissue salts. And I want to make something clear about tissue salts. Excuse me. They generally come in a 6X. That's where you'll find them most often in health food stores, etc. They're a little harder to find lately because some of the homeopathic pharmacies in the U.S. are struggling and worried. And so they're not manufacturing like they used to, but you usually find them in a 6X. So it's, calc phos, calimure, mag phos. Those are the natmure. So those are the medicines. There are 12 of them, as I said. And then there's one that's all mixed together, and it's often called bioplasma. And the one tonight we're going to talk about is Kali, K-A-L-I, muriaticum, M-U-R-I-A-T-I-C-U-M, or calimure is the short way of writing it or saying it. Calimure or calimuriaticum. Excuse me. I used this medicine for a long time. It's a great cell salt in a 6X. And I used it for glands, hardened glands, tonsils, for chronic catarrh. It almost sounds like I need it tonight, doesn't it? Follicular tonsillitis. So it's follicles in the tonsils. Enlarged tonsils. Sometimes the tonsils are so enlarged that they call them kissing tonsils. So they're almost touching. People freak out when they see that in a child. It's common in children. And they worry, oh my gosh, my child's not going to be able to breathe. It's going to be an impediment to respiration. And that's very, very rare. And I will tell you, I have a son that when he opened his mouth and started to cry, I don't know, the 3rd day after he was born, I said, whoa, look at the size of those tonsils. They were huge. He wasn't sick. He was born with them. And I believe that is can sometimes be inherited. I had very enlarged tonsils. I'd like to get my money back. I'd like to get my tonsils back. They were taken when I was 3 years old. Because they have a very important purpose. And so if the tonsils are enlarged, they may not even be painful or infected or follicular. They may, sometimes they have veins on them. You can see them because they're gotten so enlarged. But calimuriaticum, it's not the only medicine we think of for this condition, but it is one of the big ones, calimure. Now, we started to talk about potency, and I always used cell salts, including Kali muriaticum, and a 6X. Then I went to India 8 years in a row and worked side by side with the doctors Banerjee. And they used cell salts in a 3X. So I did not ask very many questions when I sat side by side with Dr. Prasanta Banerjee or Dr. Pratik Banerjee or any of the other senior doctors, because I was so, I felt so privileged to have this fellowship, being able to work with them 8 years in a row, that I didn't ask very many questions. I just observed, recorded, and thought about it. Sometimes I'd go back to my books that night, back at the hotel, or sometimes I'd ask the other doctors, but I did not want to ask too many questions. I didn't want to be a nudge. To be honest, I wanted to just be a fly on the wall and learn as much as I could. However, one of the questions I did ask was the potency on these cell salts, including Kali muriaticum. And so I asked Pratik one day, I mean, after a while we became friends after all those years. And so I didn't feel as though I was asking too many questions, but I did ask this one. I see that you use cell salts in a 3X. I use them in a 6X. And calc fluor I use in a 12X. And they can be, by the way, let me tell you parenthetically, you can use these cell salts in any potency. You can use them in a 200, in a 30, in a 1M, in a 10M, but they're most often used in these potencies that I'm describing right now. And his answer was to me was really the answer he would give anyone for just about any of the protocols that they used. And that was, this is what we use. This is what works for us. So, good enough for me. Now, I have a lot of experience. I've been using homeopathy for 33 years. I've been teaching it for 33 years. I've been in private practice full-time for about 25 years. I've studied, I've scoured the literature. I have taken this homeopathy very seriously for those 3+ decades. And so I'm always willing to learn something new. And so that was one of those moments. And it was particularly because in spite of the hours, the days, the months, and the years that I have spent immersed in this medicine, seeing many thousands, actually I figured it was close to 90 or 100,000 people over these years, I am willing to put it aside and bow to the fact that Drs. Banerjee have seen even more people than I have. They have seen 100 patients per day over many, many decades. So I bow to that and I say, at my height of seeing the most clients that I've seen in my entire practice, have been seeing or overseeing 50 cases daily. That's only half of what they've done. And I didn't have a father who was a homeopath, nor a grandfather or great uncle, etc. So I bow to that. So I'm going to teach you that you may use the 6X if that's what you've got. But if you have a condition that's important enough to treat, then I personally would say, get it in a 3X. So I'm going to read this from my Materia Medica here, and it's potassium chloride, and it is, a cell salt is of note in the treatment of chronic congestion, tonsillitis, earaches, and blockage of the Eustachian tubes. Kali mur is also considered to be of great value for subacute inflammatory states and glandular swellings, coughs that affect the eyes as if they were protruding from the head. There can be dandruff, headaches accompanied by vomiting. Now, do you need all of these in order for this medicine to be of use? Absolutely not. We're just listing the conditions that this medicine affects. Physical characteristics pointing to a need for Kali mur include a white or gray coating in the base of the tongue and expectoration of thick white phlegm. The person can be sometimes exhausted or weary of taking care of others. Boy, if I don't see that, I see many women my age, a little younger and a little older, taking care of their elderly parents, or younger women, mothers taking care of their young children. The person may have engaged in too much mothering, or others feel deprived of attention and need affection. Now, does that psychological aspect, is that mandatory that it be presenting? Absolutely not. I put this in there because I want, and I've said this before in my Materia Medica, I want you to see how we extrapolate a little bit of the classical in some of this information. I do not use classical homeopathy. I'm going to be very clear about that. I abandoned that years ago. But I do like to hearken back to some of the aspects of classical that is still valuable. And that would be in the psychological aspect. Symptoms are made worse from eating rich or fatty foods and from motion. There can be a loss of voice too. And there can be hard deposits, not only in the tonsils or on the tonsils, but in the glands themselves, so that if you palpate, you might notice that there are hard deposits, or there's a hardness that presents there. Now, this is a great medicine for the glands, but you want something really fabulous for anemia? Besides eating liver, forget the spinach. I'm sorry, vegetables don't come close to what animal foods can do in terms of high nutrients. So if there is anemia, of course we eat liver. Of course, that's just a given. You get the highest quality you can get, and you start downing it regularly. If you can't stand liver, although I can't imagine how you couldn't, because I being facetious here, I love liver. I love all kinds of liver. But if you can't stand liver, then you buy liver capsules of desiccated liver, good quality grass-fed liver. All right, we're putting that aside because we're not talking about nutrition, even though I love discussing nutrition. We're going to try to stay as focused as we can on homeopathy. Here's the thing. This is the way we use it. We use Cali Mur 3X, taken along with or mixed with in the mouth at the same time, phos. The entire word is Ferrum phos, or Ferrum phosphoricum. You see these words they're Latin, and we often shorten them. So I'm going to give you the shortened version, the abbreviated, and I'm going to give you the real word. The real word is Ferrum phosphoricum, and the abbreviation is phos. Also a cell salt, both of them in a 3X, taken simultaneously, you know, like the simultaneous sip. And you're going to put them in the mouth at the same time. You can put them in water if you want, so that they are mixed together. You can also order them if you happen to be a student or a client of mine and you purchase from OHM Pharmacy, then they sell it in that combination. That, my friends, that Cali Mur 3X plus Ferrum phos 3X is magic for anemia. Magic. If you ask me, well, what about this kind of anemia? I'm going to get those questions, so I'm going to head it off at the pass. What if it's this kind of anemia versus that kind of anemia? What if I'm nursing and it's anemia? What if it's this, and et cetera, et cetera? The bottom line is anemia. It is the umbrella. Anemia twice daily. Now, do you expect to see it like this? Like that? Bam? No, we don't. Although I have seen it come along pretty fast. I have seen it. Generally speaking, it takes longer. Now, there's one more medicine that I didn't tell you. This is a bonus that I'm giving you tonight, and I love doing this. I love to give you more than what you expected. If there is anemia, we use Cali Mur 3X mixed with Ferrum phos 3X twice daily, and China 3X. China, C-H-I-N-A. Some people pronounce it Kina, but I mean, let's not get esoteric here. It looks like China. It reads like China. It spells like China. Let's just call it China. Okay, China 3X. And that also is taken twice daily. And that, my friends, will help anemia a great deal for low ferritin. Low ferritin, absolutely. Low ferritin. So it has to do with blood, the blood labs that come back that show the ferritin is off. There's anemia. I'm trying to think of some others. Red blood cells. I'm trying to think of others. I'm sure you'll come up with them. Does liver pate count? You bet it does. Oh my gosh, it's so true. My husband just cooked organic chicken liver with garlic and onions with our spices and turmeric, ginger. Love it. Oh, that sounds really good. Yeah, liver is a very, very, very important food as far as I'm concerned. And don't let anybody tell you that, oh my gosh, it's where all the cleansing is done, so it's got to be very toxic. Well, don't buy toxic liver. Buy the quality stuff. Buy the grass-fed from the animals that are well taken care of, who have quality lives, and they're living on grass, and they have the sunshine beating on their backs. That's what we're looking for. Okay, Cali Carb Success, last week's medicine. My 4-year-old daughter has chronic UTIs that will often include kidney pain. This week she had severe back pain that was very quick onset and couldn't even walk because the pain was so bad. I reached for Metarinom and Cali Carb 200 dosed each one time, 3 minutes apart. Her pain quickly diminished, and in 10 to 15 minutes later, she was resting peacefully. You are so right. Alicia, beautiful job. You are the healer in your home. Would you choose between Cali Carb and berberis for kidney back pain, or could we use both during the same episode? One could use both, but berberis is really a little closer to what you're describing. Doesn't mean you wouldn't use it, but yep, that's the way it works. Okay, so now I'm also going to answer some questions from my mighties, because this is our first time that we can meet here. Yippee, so thankful to learn from you. Greetings from Pensacola. We survived, Sally. Yeah. Okay, hi, Elaine. I'm on the mighty side, she says. Christy, hi. The mighties area is working. Yay. I promised this weeks ago. I'm so excited we can comment here. Thank you. Okay, let's get to these comments. Great to be able to chat here. This is very exciting. So I've got my mighties here and Facebook there. And what a cool feature. It is a cool feature. This is really great. I have small chunks of raw frozen liver in the frozen mixed berry smoothies with a whole avocado and raw milk. It's done wonders for me this pregnancy. Stacy, you are so on the mark. I have bought in many times. I've got a couple of good livers in my freezer that I get from US Wellness Meats. I don't buy it from the regular grocery store, although if I had no choice, I certainly would still consider it. I think liver is so good that I would even consider eating conventionally raised liver, but because I have the ability to do so, I'm going to buy it from where I think is going to be the cleanest. And so I have it in the freezer right now myself. But when my kids were little, I used to grind it up, not unlike what Stacy's talking about. And when you put it in the food processor, when it's raw, it turns to it's liquidy of sorts. And then I would pour it in ice cube trays. And then when I made chili or meatballs or something like that, so that my kids would get liver and not complain about it. And my husband too, he's not crazy about liver either. I would pop out a couple of those cubes and mix it in with the ground beef, and lo and behold, everybody was eating liver without really realizing it. You bet. Hi, Deidre says, hi, Elaine. Okay, could you briefly talk about the blockage of Eustachian tube, especially if chronic? Yes, look, there could be more to it than that, and of course it depends on the age of the person and what else has been going on. But Calimere is excellent for Eustachian tube blockage. It's not the only one. And if there is a blockage where there is a loss of hearing, I often think of this for tinnitus with chirping. It's a specific kind of tinnitus. Isn't that fascinating? It doesn't mean it can't help other tinnitus cases, but if there is a chirping sound, I don't mean chirp, chirp, chirp. I mean chirp, like that. I can't mimic the sound of a chirp, but it's a chirping sound, and I've had it described to me in the past. If there's a blockage in the Eustachian tubes and it seems as though this person has got lymph nodes involved, etc., do consider Kali muriaticum, and then I would use it in a 3X and twice daily. Now, remember that anything that has to do with eustachian tubes, lymph nodes, in this whole area. And I will be talking about this in the future. I'd like to do a whole course on this, to be honest. Think dental. Think dental. Just because you don't feel pain, doesn't feel as though you have an infection in your maxillary or your mandible, does not mean you don't have that. And I'm not saying you should be frightened of it, but do think, if you've had wisdom teeth extracted, if you've ever had an infection in your teeth after a tooth was extracted, if you've had root canals, do think of that as a possibility. That is a very important thing. And actually, I've talked about this a great deal in my course, Antibiotic Alternatives. That's a good course. Listen, anyone who's ever concerned about using antibiotics might want to consider looking at that course, at least taking a look at it. Hi, Joette. If you are treating a few issues, can you take the different medicines all at the same time, or do you need to spread them out? They can be taken in the same schedule. That means you take the Calimure with the Ferrum phos in the mouth simultaneously. Okay, wait a few minutes. Now, maybe you use let's say it was Berberis, like what Alicia said. Berberis 200. Oh, maybe about 2 minutes later, 5 minutes later. Then maybe that person also has terrible anxiety and they want to take aconitum. So they take aconitum a few minutes later. Yes, these all can be in one schedule. I know it flies in the face of what the classical homeopaths say we should or shouldn't do, and I adhered to that for far too many years. Don't listen to it. Trust me, it's important to get many conditions resolved in short order. Now we're almost done, but I do want to tell you, and I believe that this is already up in Mighties, and this is a YouTube by Dr. Carrie. What's her name? Madej, M-A-D-E-J, M-A-D-E-J, Dr. Carrie, C-A-R-R-I-E, Madej. She's an internist. Check her out. Now, I believe that Natalie's has already put it up on Mighties earlier today, or maybe it was Perry, and it's probably going to be here on Facebook Live. Get it, download it, because I guarantee YouTube's going to ban it. I guarantee it. The name of the YouTube program, or the title that she used, was Human 2.0. Download it. Own it. Put it aside. Send it to everyone you know. This doctor is right on the mark. I won't tell you what it's all about, because if I say the words, they certainly will take me down tonight. So let's see. The link that the video didn't work for me today. Is there another link? Check it out. Oh, I hope they haven't taken her down already. Just in your browser, put in Dr. Carrie, C-A-R-R-I-E, Madej, M-A-D-E-J, Human 2.0. And that was the title of it. If you have any trouble online, it should be on Mighties. If you're having trouble with it on Mighties, the link is for that video didn't work. Okay, so I guess we'll have to put it up again in Mighties, and we'll make sure that you folks get this. This is important information, folks. Stay informed. Turn off your television. In fact, kill your television. I believe in murder. Murdering the television. Get rid of that darn television. I'm cleaning up my language. Get rid of the darned television. It is only going to poison your thinking. It is intended to create fear, because fear creates compliancy. And that's what I want you to be very wary of. And so, let's see. I'm sorry. I talked far too long. Okay, yes. Joey says, if you have a trouble downloading somebody that might have been censored, go to me. We are going to DuckDuckGo. I think that's what she said. I read it very quickly. Hi, Marla. Okay, here we go. I think that's it. I wish I could answer all your questions, but I've got a class now. It's a study group class. So remember, folks, pass this information on. God bless all of you, and have a great week. See you next Monday. Bye.